Then after the death of the person, the autopsy findings, although not very specific, but the gastrointestinal congestion is a noteworthy features in the acute arsenic poisoning and varies from a mere reddening of the mucosa, that is red velvet, to the frank hemorrhagic gastritis. Focal hemorrhages giving rise to flea-bitten appearance is the said to be characteristic. Intestine may be inflamed and may contain the rice water contents. Then subendocardial hemorrhages may be seen. There may be evidence of fatty degeneration of heart, liver and kidney. There is long held belief that arsenic preserves the dead body by delaying the putrefaction, though there is no enough scientific validation for this. Chronic arsenic poisoning may present features of non-specific gastrointestinal inflammation as well as renal and hepatic damages. Chronic arsenic poisoning may present with features of non-specific gastrointestinal inflammation as well as renal and hepatic damages at the autopsy. Apart from the routine viscera and the body fluids, a piece of long bone, preferably the femur bone, a bunch of pulled scalp hair, a wedge of muscle, and a small portion of skin, usually from the back of the trunk, must be preserved for the chemical analysis. So, with the help of the proper history, the clinical features presentation in hospitals, medical records, and the autopsy examination and further confirmation by the lab investigations will be highly suggestive for making diagnosis of the death due to arsenic poisoning. Then certain other important facts that we must know for the medico-legal point of view. We already discussed many of the medico-legal importance of arsenic and few cases linked with arsenic like the murder of Napoleon. Some other relevant facts like postmortem imbibition of arsenic. If high arsenic content is found in exhumed bodies, the defense may take the plea that the arsenic had leached into the body from the surrounding soil. There are two objections to this argument. One is the solubility of the arsenic, that is, arsenic is found in an insoluble form in the soil. For it to able to reach inside the body, it must be in the soluble form. Then the concentration of the arsenic found in the body cannot be higher than the soil if the arsenic has leached from the soil. So these arguments may be taken. However, again the counter arguments that has been given is that the bacterial activity, some anaerobic bacteria have been demonstrated in the grave soil which can convert insoluble arsenic into the soluble arsenic, and further their metabolic activity cause an exchange of soil arsenic with that of sulfur in the air. Body concentration of the arsenic may also be higher than the concentration in the soil. So this has been the argument and the counter argument, and depending upon the concentration variation we may decide, and further the clinical correlation and the autopsy finding may help to decide the case. Then as a homicidal poison, it was a most favorite homicidal poison before 1836 until the mass test was developed, and when its diagnosis became easier, thereafter it lost its prestige from the ideal homicidal poisoning. Then certain arseniophagists, they are the people who take arsenic daily in the mistaken belief that it is aphrodisiacs, that is increases the sexual desire and the pleasure. So these aphrodisiacs develops the tolerance and can take up to the 300 milligram or more in one dose without apparent harm to them. However, on the long run, they develop the signs of chronic toxicity that need to be differentiated with the chronic arsenic poisoning. Then the safe level in drinking water is prescribed as 10 parts per billion. Hydroarsenism from the contaminated groundwater has resulted in a large scale environmental poisoning. Especially we saw the case of the Bangladesh, their whole of the village of population inculcating more than lakhs was involved. Then the black foot disease is the interesting fact to know that it is an endemic peripheral vascular disease first seen in the southwestern coast of the Taiwan. Its peak incidence was during 1956 to 1960. It is associated with the consumption of inorganic arsenic found in artesian wells. The incidence decreased dramatically after the implementation of tap water. Then under this Blackfoot disease, that is the peripheral vascular disease, it is developed as arsenic induces atherosclerosis by damage to the endothelial cells, increasing the coagulability of the blood and decrease in the fibrinolysis, as well as increases the inflammatory activity in the vessels. The clinical features in case of the Blackfoot disease are the numbness, coldness of the feet, intermittent claudication, absence of peripheral pulsation. Mostly it affects the lower limbs. In rare cases, fingers may also be involved. Typically results in the ulceration, gangrene and a spontaneous or surgical amputation, and finally it may lead also to the death of the person. Then arsenic is used along with the drugs of addiction like cocaine and opium. Generally, arsenic is contaminated with the cocaine and opium. Opium is adulterated with arsenic in varying quantities because it is believed to be a general tonic and an aphrodisiac. When arsenic is combined with the opium, it is thought to enhance the aphrodisiac quality of the opium. Quite often, opium eaters present with neuropathy and hepatomegaly due to chronic arsenic poisoning. Arsenic levels are increased in the serum urine, nails and hairs of the opium eaters with and without neuropathy. Also, the homemade brew shows the increased level of the arsenic. Then increased arsenic level may be found in certain naturally occurring disease like alcoholic cirrhosis, alcohol related liver disease, fulminant hepatitis, Indian childhood cirrhosis, non-cirrhotic portal fibrosis and Wilson's disease. Arsenic is the major component of cigarette smoke. It is thought that it plays a part in the development of the cancer. Then seafoods are exceptionally rich in the arsenic. Sea fishes in comparison to freshwater fishes may contain the 10 times more quantity of the arsenic. Mussels, oysters, prawns, shellfish all contain arsenic in varying amounts. Urine of the person who consumed the large amount of the seafood may contain the increased arsenic up to 0.7 mg per liter, which may mimic the chronic arsenic poisoning. Arsenic is also used as a therapeutic agent. Recently, arsenic trioxide has been introduced in the treatment of acute promyelocytic leukemia. Solid tumors markedly increase the effect of hypothermia on the tumors. Solid tumors may get the benefit of the arsenic as it causes hypothermia on the tumors. Then occupational exposure with the arsenic is also very common. Also, the chronic arsenic poisoning is said to hasten the process of mummification, that is studied along with the postmortem and the after death changes. Arsenic poisoning is also associated commonly with the occupational exposure. So, the employer's liability to pay the compensation in cases of occupational disease due to arsenic is mentioned in the Schedule 3 of the Workmen's Compensation Act 1923. Therefore, if a worker contracts any occupational disease due to arsenic, employer is liable for compensation. Other heavy metal mentioned in this schedule are the beryllium, cadmium, chromium, lead, manganese and mercury. Relevant non-metal included are phosphorus, organophosphorus, and the asphyxiants that are included under the list are the carbon monoxide, hydrogen sulfide and nitrous fumes. So this is all about arsenic poisoning. We will learn remaining metals in the next class. Thank you.